We're doing really well here, Neil. Thank you.
All right, today's topic: false labor. What are the other names for false labor? Who said false labor? No, false labor.
That's what the word did to my false. Anyway, sorry. Yeah, Braxton Hicks would be one name, and prodromal labor is another name for false labor. All basically the same thing.
What is the definition of false labor?
Well, you've got Braxton Hicks, prodromal labor, false labor. They all feel like real labor, but they're not, and they don't lead to progression of labor.
Is false labor uncomfortable?
It can be. There's a lot of moms who really don't know for sure whether they're in real labor or false labor. But with false labor, the contractions aren't painful enough, they're not often enough, long enough, or strong enough to cause progressive and steady cervical dilatation.
What is the definition of true labor?
Contractions that are strong enough, long enough, and frequent enough to cause progressive and steady dilation of the cervix.
What are Braxton Hicks contractions?
Well, we used to call them practice pains. Now I think we call them practice contractions, but they really prepare the uterus and cervix for real labor. They certainly can occur throughout pregnancy, but they're more common in the second and third trimesters.
What are prodromal labor?
Prodromal labor is a time of preparation for real labor. Contractions are short, not as strong, and they're very frequent. They cause thinning and softening of the cervix, again, to prepare for real labor, but the contractions aren't as strong as real labor. They are perceived as a backache. Women might feel like they're having a period.
What is the difference between false labor and true labor?
That is the in real labor, the contractions are strong enough to cause progressive and steady descent of the baby's head and cervical change, which includes thinning or effacement, and cervical opening or dilation.
What are commonly listed causes for false labor?
These are listed. I'm not sure exactly whether they are, but this is what Mayo Clinic says. Dehydration, illness, baby's movement, activity, and even sometimes a full bladder.
If you think you have false labor, what should you do?
Well, try resting, drinking water, changing positions. If your contractions don't either subside or become stronger and more regular, then contact your healthcare provider or visit labor and delivery.
How long can you have a prodromal labor or Braxton Hicks contractions before you can go into real labor?
Let's see. Oh, where did you go? Oh, I see. Um, you can have those for a long time, off and on. So it's really hard to say exactly how long it will be.
As a woman gets closer to their due date, many wonder why labor doesn't start. What causes labor to start?
The main thing is baby's maturity. Baby says when it's time to get delivered. That's why sometimes inductions are hard because baby is just not ready.
When should I call my doctor or go to labor and delivery?
If you have bleeding, loss of amniotic fluid, severe pain, loss of movement, fetal movement, or no fetal movement, you need to seek medical attention immediately. Go to labor and delivery.
Can labor start and stop?
Most of the times it doesn't really. Really, if you're really in labor, it doesn't stop. But yes, you can get hung up, especially during an induction.
Can you be in labor and not know it?
Many women who have many babies seem to be in labor, or they seem to make progress without having a lot of pain or complaints. So, yeah, I guess you can be in labor without knowing it.
What is the latent phase of active labor?
The latent phase of labor is the first part of the first stage. The first stage is labor, that is from when labor starts until pushing. But that's divided into two pieces. The latent phase is the first part, and we usually say that's until the cervix gets to be 3 or 4 centimeters. After that is the acceleration phase, which is when contractions really get punchy and cervical dilatation uh, proceeds rapidly.
What are the four stages of labor?
There's the first stage, which is from when labor starts until pushing starts or complete cervical dilation. The second stage is the pushing and the birth of the baby. The third stage is separation of the placenta and delivery of the placenta. And the fourth stage is the first 2 hours after birth.
Is it easy to tell the difference between prodromal labor and the first stage of labor?
Those two are really hard to tell apart. And certainly, prodromal labor makes the uterus ready to actually have good contractions. No, the uterus is um, the only muscle in the body that can change its myosin. In other words, its ability to contract. All other muscles have a fixed ability. So I think what is happening here in prodromal labor is actually the uterus is figuring out which length the myosin is going to take. So it's really getting ready, and labor is the hard, the business, the business part of having a baby.
All right, the best place to go is world.allen.com and pick up Pregnancy Your Way available